What if I told you that nearly 40% of adults over 65 received at least one unnecessary medical test last year? That's not a scare tactic. That's data from a 2023 review of senior care across the US and 4 million of older adults. Those tests didn't lead to better health. They led to confusion, stress, and in many cases more tests. You walk in feeling fine. You walk out with a blood draw, a scan, and a vague sense of unease. A week later, you're in a specialist's office talking about a finding no one seems worried about, but they want to keep an eye on it anyway. Sound familiar? This is what some surgeons and geriatric specialists are now warning against. Because after 60, the issue isn't too little testing, it's misaligned testing. The right test at the wrong time in the wrong person can quietly chip away at your peace of mind and sometimes even lead to unnecessary treatment. In this video, we'll explore 5 common tests that may sound helpful, but are often overused in older adults, especially when there are no clear symptoms. These aren't bad tests, but like many things in medicine, context is everything. And number 2 on the list, it's something almost every senior is encouraged to do. Yet most don't realize how often is too often. So if you've ever wondered, do I really need this? You're not being difficult, you're being smart. Let's talk about how to ask the right questions and what to watch for before saying yes to your next test. Have you ever had a test done just to be safe and ended up feeling more anxious afterward? Maybe it was a blood test that led to a callback, or a scan that found something not serious but still needed monitoring, or an EKG that flagged an abnormality you'd never felt, and now you're Googling heart conditions at AM. If that's ever happened to you, you're not alone. Thousands of seniors have shared the same experience. The test felt routine, but the aftermath felt anything but. And that's why this video matters, because knowing which tests help and which to question can save you time, stress, and unnecessary procedures down the road. Let's start with one that's become almost automatic in recent years. It sounds harmless. It's just a blood check, right? But for many older adults, this one test leads to a surprising chain of supplements, side effects, and confusion. Number 5. Routine vitamin D tests. When just checking creates more confusion, it sounds like the simplest, most harmless thing. Get your vitamin D checked. But here's what most people don't realize: routine vitamin D tests in healthy older adults with no symptoms or risk factors often do more harm than good. Why? Because the results frequently fall into a gray zone. Not deficient, not optimal, and that leads many seniors to start taking high-dose supplements they may not need without clear benefit. According to the Endocrine Society's 2022 guidance, routine vitamin D testing in low-risk adults doesn't reliably change outcomes, and, in some cases, unnecessary supplementation has led to kidney strain and calcium imbalances. Judith, 72, a retired dentist in Arizona, went in for her annual labs. Her vitamin D came back low normal, and she was advised to take a high-dose supplement daily. Months later, she started experiencing nausea and fatigue. A recheck showed her levels had overshot. It was more stressful fixing the supplement side effects than the original issue, she said. Here's what many specialists now recommend. Instead of testing everyone, assess your risk. Do you have a history of low D? Limited sun exposure? Bone loss? If not, it may be worth discussing whether testing is necessary at all. This first test sounds harmless, but often leads to pills you may not even need. Number 4. Full body scans without symptoms. When curiosity becomes a cascade, the idea is tempting. A full body scan that checks for everything. Who wouldn't want peace of mind? But here's the issue: these scans often find harmless anomalies. Things you've had for years, cysts, nodules, tiny calcifications, most mean nothing. But once they're found, they can trigger a cascade of follow-up tests, biopsies, and anxiety. A 2021 study in JAMA Internal Medicine showed that whole-body scans in asymptomatic older adults had a high false positive rate, with many patients undergoing procedures for findings that were never dangerous. Bill, 75, an accountant from Florida, decided to do a baseline scan after seeing an ad. It found a benign kidney cyst. His doctor wasn't concerned but recommended an ultrasound follow-up that turned into a CT, then a urology consult, all for something that never changed. It dominated 3 months of my life, he said, and I felt perfectly healthy the whole time. Here's the general rule. Full body scans may be appropriate if you have a history, symptoms, or specific risk factors. But scanning just to be sure often leads to more harm than clarity. Here's where curiosity becomes costly, especially when no symptoms are present. Number 3. Annual EKGs in low-risk adults. The test that creates questions. Where there were none, the EKG is fast, painless, and often offered as a quick checkup for the heart. But in low-risk adults with no symptoms, routine annual EKGs have been shown to generate more false alarms than true benefit. According to the American College of Cardiology's 2020 guidance, routine EKGs in asymptomatic, low-risk seniors resulted in a high rate of false positives leading to cardiology referrals, stress tests, and in some cases, even unnecessary procedures. Denise, 68, a retired teacher in Oregon, had an EKG at a community health fair. It flagged a borderline result. Her doctor ordered another one. That one was fine, but not before a week of worry and a $300 out-of-pocket bill for a specialist visit. It made me feel like something was wrong with me when I'd never had a single symptom, she shared. Now, if you've had symptoms like chest discomfort, fatigue, dizziness, an EKG makes total sense. Same if you're at high cardiovascular risk. But if your heart's been steady and you feel fine, it's okay to ask, will this test change what we do next? You feel fine, yet the scan says otherwise. And suddenly you're in a specialist's office. Let's pause here for a moment. You've just heard 3 common tests that many seniors go through, often with the best of intentions. But what's the pattern? They weren't wrong. They just weren't right for the moment. That's what this video is really about. Not about saying no to care, but about asking the smarter question. Will this test actually change what we do? Because after 60, your body changes. But so does the way care should be delivered. The one-size-fits-all testing model from your 40s doesn't always make sense anymore. And more tests don't always mean more protection. That's why so many clinicians are rethinking how and when we test. It's not about being afraid of information, it's about making sure the information helps, not harms. If this kind of grounded, senior-specific advice resonates with you, feel free to subscribe. We cover these nuances often without hype, without fear, just clarity and respect for how aging actually works. Now let's look at 2 final tests. One is pushed far more frequently than it needs to be. The other. It's given at nearly every wellness visit but may quietly damage your confidence if used carelessly. Let's move on to something that sounds helpful but may be repeated far too often without real benefit. We're talking about bone density scans. Now, don't get me wrong, bone scans can be incredibly useful, especially after major changes like menopause or a fracture. But here's the catch. Once you've had your baseline, repeating that test every single year. For many older adults, it doesn't tell us anything new. According to the National Osteoporosis Foundation, if your health and risk factors are stable, repeating bone scans more than every 2 to 3 years doesn't typically change your treatment plan. And yet, many people over 60 are still told to do them annually. That's exactly what happened to Ralph, a 76-year-old former pilot from Nevada. For 5 years, he got that same scan, over and over each time with the same result. No change, no new action, just more out-of-pocket costs and more time in medical offices. It felt like a routine, not a decision, he said. Now, if you've started a new medication, lost significant weight, or experienced a fracture, yes, a repeat scan could be important. But if things are steady, it's worth asking your doctor if spacing them out might be safer and simpler. And finally, we arrive at the last one, a test that often sounds like a good idea, but may quietly do more harm than we expect, not to your body, but to your sense of self. Let's talk about cognitive screenings. Mental sharpness is a valid concern as we age, but here's what many people don't realize. When these screenings are done without context, meaning there's no real concern, no reported issue, they can plant a seed of doubt that didn't need to be there. Imagine this. You go in for a routine checkup. The nurse asks you a few memory questions. You weren't expecting it, you're a little distracted, maybe hungry, and suddenly the score comes back borderline. Now your doctor is watching more closely. Your family starts asking questions, and you begin wondering, was that just a bad day? Or something worse? That's what happened to Elaine, a 70-year-old retired librarian from Illinois. She had no memory complaints, no functional concerns, yet one screening flagged her as mildly impaired. The stress that followed actually made her feel worse. I started second-guessing every little thing, she told us. Here's the better approach. If you or someone close to you notices real changes like trouble managing bills, forgetting appointments, or getting lost, then yes, testing can help. But using cognitive screenings as a box to check without cause may undermine confidence more than it protects health. And that's something no piece of paper can measure. Let's take a step back for a moment. You've just heard 5 common medical tests. None of them are dangerous on their own. In fact, in the right situation, every single one of them can be helpful, even life-saving. But here's the key that most people don't talk about. After 60, it's not just about what test you take. It's about why, when, and whether it actually changes what happens next. Because when a test is done without a clear purpose just to check, you're more likely to face false alarms, unnecessary treatments, and emotional stress that wasn't even part of the picture before. And the real trade-off. It's not just about cost or appointments, it's about clarity, about whether that test is helping you feel more confident or making you feel like something's wrong, even when it's not. That's why many healthcare professionals are shifting away from routine blanket screenings and toward personalized testing decisions based on your history, your symptoms, and what you actually need. So no, this isn't about skipping care. It's about protecting your peace of mind. It's about asking better questions, like, if I do this test, will it change what we do next? And if the answer is no, it might not be the right time for that test. You deserve care that respects your age, your independence, and your time. And that starts with knowing that more testing doesn't always mean better health. So let's talk about how to use this information in real life without second-guessing everything. The next time a test is offered to you, whether it's at a checkup, a health fair, or during a hospital visit, just pause and ask one simple question. Will this test change what happens next? If the answer is yes, great, you've got a clear path forward. If the answer is no, or if your doctor hesitates, that's your chance to start a better conversation. Here's another phrase that works well. Do I need this now, or is this something to keep an eye on? It's not confrontational, it's thoughtful, and it shows you're making decisions together, not just receiving orders. And here's the good news. Most clinicians will welcome that kind of question, because the best care comes from collaboration, not passivity. A few more tips to help keep you grounded. If you get a test result that's unclear or borderline, don't panic. Ask for clarification. Sometimes what sounds abnormal is actually very common in older adults. If a screening is suggested without symptoms, like a cognitive check during a basic visit, ask what prompted it. You're allowed to say no if there's no cause for concern. And most importantly, trust your lived experience. You know your own body. You know your own mind. Use that wisdom to help guide your care, not just your numbers. Let's also be clear. This video is for general wellness and educational purposes only. It is not medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional before making health changes. You're not refusing care. You're taking ownership of it, and that makes all the difference. Let's leave you with this. When you're over 60, it's easy to feel like more testing equals more protection, that the only way to stay safe is to check everything, all the time. But here's the quiet truth. Real safety comes from understanding, not from overchecking, because the wrong test at the wrong time can shake your confidence. It can turn normal aging into a medical journey you didn't need. It can leave you with more questions than answers. That's why being selective isn't reckless, it's wise. You're not saying no to healthcare. You're saying yes to the kind of care that actually fits your life. So here's your next step. Choose one test from today's video that you've either had or been offered recently. Think back. Did it lead to peace of mind, or did it add more complexity? Then drop a comment with your age and which test stood out most for you. We read every single one, and we're building future videos around the patterns you share. And if you found this video helpful, don't forget to subscribe, because next time we're covering 7 health questions every senior should ask before saying yes to a test. That's a checklist you'll want in your back pocket. Until then, stay curious, stay confident, and remember, you're not fragile. You're just wiser now.